I am Dr. Priya Praveen, Retna Global Hospital, Trichy. Here I am going to show what is non-pneumatic anti-shock garment, when to use it, how to use it, and when to remove it. Non-pneumatic anti-shock garment is a garment which is used for PPH, that is postpartum hemorrhage, to prevent the patient going in for hypovolemic shock. So now we will see how to apply the anti-shock garment. First, the patient should be in the supine position and the garment should be underneath the patient. And first, we need to see whether the spotted lines in the garment is aligned with the spine of the patient. Okay, and the leg should be open. And we need to fix the garment from the number 1. So the first thing to apply is the number 1, and there should be 2 persons, one on the right side and one on the left side. And first we will fix the number 1 in the ankle of the patient. So it should be compressed tight enough to compress the blood vessels inside, and you should see whether the compression is okay or not. If the sound comes like this, it is tight enough. And now the second one should fix on the calf of the patient. Okay. So now the 2 parts are over, and now the third one, it is to be kept on the thighs. Okay. Once you keep it, we need to check whether we are able to flex the knee. The knee should be flexed so that we can do any procedures using this garment. Now the fourth one is the pelvis. Pelvis garment should be applied with a single person. Okay, so that we need to see how the compression has been done. So now the pelvis is fixed. And now here the fifth one. There is a pressure ball in the fifth one that should be kept at the level of umbilicus of the patient. And now the sixth one. It should be tight enough to compress the uterus, and in turn it will compress the aorta of the patient. So this is the correct way of applying the anti-shock garment. Now we see what is the benefit of applying this anti-shock garment. When we compress the blood vessels of the lower part of the body, the blood to the vital organs like brain, heart, lungs and kidney get the adequate supply, and it prevents the patient from going in for hypovolemic shock. So now we see how we remove the anti-shock garment. Once the patient gets stabilized, if the BP is normal, that the systolic BP should not be below 90, or there should not be any tachycardia, that is the heart rate of the patient should not be above 90, and the bleeding should be arrested. So when we feel that the patient is stable, then we can remove the garment. So first removal should be from the lower end. We will remove the number 1 first, and we have to wait for 15 minutes. And in the meantime, if the patient's vitals is not stable, like again the PP drops or the tachycardia develops, then we have to reapply the anti-shock garment. And if the patient is stabilized, there is no change in their vitals, then we have to go to the next number 2. And again we have to wait for 15 minutes. And then number 3 and number 4 at the level of pelvis, and then number 5 and number 6. It should be step by step, and once the patient is very well settled and bleeding has been arrested, and if we are in a position to shift, then we can shift the patient. This garment is of neoprene material, and it can be washed multiple times and used multiple times, up to 40 applications, and it can be washed with mild soap and water, and it should be sun dried before use. So this garment is really useful during a case of postpartum hemorrhage, and each and every institution should have this garment, and the staff should be adequately trained to use it, and we can in turn prevent maternal mortality. Thank you.